Right to KPIX5's Len Ramirez. He is live at the Public Health Department in San Jose, where a briefing wrapped up just a few minutes ago. Len?
That's right. This is a very, very serious situation in Santa Clara County right now. And you could tell that from the somber faces of the medical officials who are out here today announcing Santa Clara County's third case of the novel coronavirus. Now, that case involves an elderly woman with chronic health condition. She sought medical attention, and her doctor recognized some of her symptoms and decided to call the health department. The tests were done on that woman, and they came back Wednesday night that she was positive for the novel coronavirus. Now, this case is different from the previous cases that we have had in the county because this woman had not recently traveled overseas. She was not in contact with any close family members who had traveled overseas, so she got it somehow through the community. Now, the county health officer says that this is a turning point, and the community now must prepare for the possibility of widespread community transmission.
This case does signal to us that it's now time to shift how we respond to the novel coronavirus. What we know now is that the virus is here, present at some level, but we still don't know to what degree. An important priority, therefore, for us is to conduct public health surveillance to determine the extent of what's happening.
Now, health officials are saying that this is most likely transmitted person to person, but they're also urging schools and government buildings as well as businesses to step up their efforts to wipe down surfaces, because it was said today from someone from the CDC, the Centers for Disease Control, that this virus can survive on surfaces.
The virus can survive on surfaces for a fairly prolonged period of time, more than days. But it is also very susceptible to cleaning products. It's mostly a person-to-person transmission that we're concerned about for our communities.
Now, county health officials are stepping up their community surveillance. Literal phone banks have been set up with county health workers who are calling people who may have come in contact with any of these individuals, as well as people who have previously reported symptoms, to see literally what their temperature is. They're calling throughout the community. They likened it to the type of thing that you would see on election night when the get out the vote happens, but this time they're calling people, just checking their symptoms to make sure that they are still okay, and that is called community surveillance. They are stepping up that practice here in Santa Clara County now. But Alan, I know this is something that we've talked about that could happen in the Bay Area, and it is already here. We have to face the fact that coronavirus is in the community, and we have to take precautions now to make sure that it doesn't spread, or we can slow the spread.
It is, Len, but we are also in the middle of cold and flu season, the regular stuff, and a lot of people sick. They get cough, sniffles. They're not, most of them, going to get the coronavirus. When are you supposed to take those concerns to the doctor, though?
Well, the health officer said today that you should really watch your symptoms carefully, but the main thing is a fever. If you have a very high fever, then that is probably the dead giveaway, that you should make that call to your doctor, and then you let your doctor and the medical professionals take it from there. But a fever is the thing to watch for.
Okay, good advice. All right, Len Ramirez, thanks so much.